The Wound Care Workbench segment continues to be a popular segment on the Woundwire. And today we're going to be talking about venous insufficiency, lymphedema, and venous ulceration. The treatment for these diseases is simply compression. And we are going to introduce you to an amazing compression therapy called EdemaWare. This has been created by Dr. Martin Winkler from the University of Nebraska. Dr. Winkler, using longitudinal Yale compression, has achieved just incredible, amazing results in patients across the country. I recently joined Dr. Greg Bond, who has extensive experience using the product, as well as Dr. Winkler at the Clinical Symposium for Advances in Skin and Wound Care in Las Vegas, where Dr. Winkler presented a poster demonstrating outstanding clinical results using EdemaWare, longitudinal Yale compression. Let's go to Las Vegas at the Clinical Symposium and join Dr. Winkler and Dr. Bond. So here we are at the Clinical Symposium for Advances in Skin and Wound Care in Las Vegas. I'm joined here by Dr. Martin Winkler and Dr. Greg Bond. Martin, good to see you.
Good to see you.
Greg, good to see you. You guys enjoying the meeting?
Very much so. It's a great meeting.
Great clinical meeting.
A lot of good clinical stuff here.
Sunday night, and when you're in Las Vegas on Sunday night, there's no place to be like a wound meeting.
Well, we're not here to talk about the sites in Vegas. We're here to talk about a new technology that you, Marty, are a mastermind of. It is called EdemaWare. And this is what it looks like. But before we talk about the product, Martin, you have a poster. We're here in the poster session at the symposium, and you've got a beautiful poster here. Would you mind walking us, the Woundwire audience, through your poster?
Sure, I'd love to. This poster looks at 4 patients who have profound arterial ischemia. None of these patients had Doppler signals in their feet, and they all needed compression. So we know, or we believe, that compression is bad for patients with arterial insufficiency. So these patients have profound arterial insufficiency, and we used EdemaWare with really great results. Let's look at just one patient. This woman taught me a great deal. I had done a left below knee amputation, and she took 9 months to be rehabilitated, and then she came in with this right foot. It was swollen. She had 1, 2, 3 arterial ulcers. She was not a candidate for revascularization because she had partial paraplegia. She had power in her hips, but no power. She had below knee, she didn't have any muscle power. So you're not supposed to revascularize paralyzed limbs. She refused amputation, so I liked her, so I just kept taking care of her. She's the first patient that I ever used ultrasound on to debride. We got a 3-week tour of the Sonic One debriding system. I turned the power way down, and we could debride her without pain. But I believe that the EdemaWare should be directly on the granulation tissue. So here we are in January of 10, 5 weeks after Apligraft, and you can see that she's well on her way to healing. And now down here we have a crucifix which has the Lord's Prayer in it, which she thought was the reason it healed. But the reason I took this picture is she healed without a scar. So how does that work? And we now think that when you have healing without scars, it's because the healing is due to circulating epithelial precursors from the bone marrow. They come to the wound, they establish themselves, and their daughters close the wound. Edema is the curse of the wounded class. So when VAC therapy first came out, we wondered, what is this VAC doing? Well, one thing we know it does is suck extra water out of the wound, and that probably in retrospect allowed the daughter cells to take off. We know that controlling biofilm is really important. Well, what does killing bacteria do? Probably the bacteria kill daughter cells. Anyway, EdemaWare in these 4 patients proved not just safe for arterial ischemia, but actually effective as therapy.